Myopia magazine will see an amazing new operation that permanently corrects nearsightedness in just 15 minutes.
Well, for all practical purposes, this is one of the editing suites at Snezell Studios in San Francisco. And this is Joe. Obviously, he has good eyesight. I see he's not wearing any form of corrective lenses. But believe it or not, there are 55 million of us in America that are nearsighted. But we need not be anymore because of a new surgical technique. Some call it a miracle. Why don't we watch it, and then we'll decide for ourselves.
I've had people wake up in the middle of the night and grope for the wall, where's the clock, and following the surgery, they can get up and they can walk around their house. You're not talking about the possibility. It's been happening for 8 years. People have thrown their glasses away. I predict that within 2 or 3 years, this will be the most performed procedure in this country.
The surgery that Dr. George Simon is referring to is a revolutionary eye surgical technique, radial keratotomy, or myoptic surgery. In simple terms, the surgery cures nearsightedness. 55 million Americans fall victim to visual aids of one sort or another, and Sue Keaton is one of them. 25 years old, a San Francisco bookkeeper, normal in every respect except Sue can barely see past the end of her nose.
Wearing glasses, you're handicapped. If you don't have, you need your glasses. You need glasses or contacts. And if I don't have my glasses with me, I can't do anything. It's going to change my life.
Sue is about to undergo myoptic surgery. If successful, and there's a good chance it will be, she can throw away her glasses for good. Dr. Simon has been performing this new and exciting procedure for the last 2 years with amazing results, a 96% success rate of improving nearsightedness. The procedure itself is rather simple. The 15-minute operation will consist of a local anesthetic, an eye drop to be truthful, and the patient is awake and conscious throughout the operation.
It's a very, very precise procedure. It requires expert measurement and execution.
The surgery will consist of 6 to 18 microfine incisions to flatten the cornea and thus improve vision. The operation is fairly new. It began in 1974, so the long-range effects are still in question.
After 8 years and using sophisticated instrumentation that we have available today, we see no change in the structure of the cornea after 4 to 6 weeks after the actual surgery. And there's no reason whatsoever to believe that there's going to be any change after 8 years. So, in effect, when people ask me this question, and many patients do, I tell them that having your eye operated on is just like having a nose job done. Once you get it done, it's done, and the results are permanent.
Sue's surgery, her first step to new vision, is about to begin. The operation will take place not in a hospital, but a surgical center under sterile conditions. And Dr. Simon is in verbal contact with his patient throughout the procedure.
Hey, Susan?
Yes.
Set?
Yes, I'm set.
Okay. We're doing the right eye, correct?
Right. Yes.
This is the right eye?
Yes.
Okay. Ready to go now. I want you to hold absolutely still.
As the operation continues, we now enter the microscope itself. What it and Dr. Simon see is the exposed eyeballing cornea. With a diamond-sharp blade, the doctor begins his radial incisions. Sue will need 8 in all.
Well, everything is beautiful so far.
The operation lasts a little more than a quarter hour, and Dr. Simon is happy to report no complications.
Okay, we're finished. That wasn't bad, was it?
No, it wasn't bad at all.
Okay, all I have to do now is just irrigate the incisions, check their depth and length, put a patch on, and on you go.
A patch and a shield will be placed over the eye to protect it. A few final words, and the operation draws to a conclusion.
Okay, you can open your eyes now. Great, did terrific, seriously. And you have no restrictions tonight as far as what happens tonight is you go home, there's no restrictions.
Okay.
Just be careful not to bump or press on your eye. You may have some discomfort tonight. You'll have some pain medication and a sleeping pill if you need it. And I want to see you in the office tomorrow morning at 11 o'clock.
The next day, after a night with some pain and discomfort, Sue reports back to Dr. Simon. The moment was at hand. The payoff. Was the operation successful? Would her sight be restored? The eye patch was about to come off.
As soon as I take the patch off, you'll start feeling a lot better and you shouldn't have any discomfort from here on. You may hurt a little bit. Some people say this is the worst part of the surgery. We'll take it off slowly. And you should be able to see somewhat, but things are going to be a little blurry. Almost off. There we go. How does that feel now?
It's blurry, but I can notice a difference.
Good.
I can see a little clearer. Yeah, it's still real blurry and sore, but I can tell.
Her vision had already improved, and over the course of the next week, her vision would have been restored to 20/15, better than 20/20, better than perfect vision.
Just amazing.
If this is a miracle, it's a miracle of modern science. 8 years ago, nearsightedness and glasses were something you just learned to live with. But today, people like Sue Keaton see the world in a new way. Because today, Sue Keaton has thrown away her glasses for good. And as she says, seeing is believing. Well, there's one question in that story that we did not answer. The question is, how much will it cost you? It's about $1,200 per eye, $2,400 total, but then again, you can throw away your glasses for good. How about modern science and what's
How
happening?
about that? You know, some people might say $2,400, that's a lot of money, but you know, when it comes to something as important as your eyesight, you certainly do not want to skimp on that.
And a lot of people I know would pay $1 million to have 20/20 vision.
That's true. We're in touch, so you be in touch.
As Hugh Downs says, right? Okay.